The revised Dentist Code of Ethics Regulation 2014, issued by the Dental Council of India (DCI), provides a comprehensive ethical framework for dental practitioners to ensure a professionalism, accountability, and highest standards of care. Below is the simplified gist of some of the topics in this 18-page gazetted notification. General responsibility of the dentist, professional conduct, prohibition of unethical practices, relationship with the patient, record keeping and documentation, continued dental education (CDE), ethical research practices, fee structure and transparency, advertising guidelines, prohibition of unrecognized titles, public health responsibilities, respect for colleagues, prohibition of practices beyond competence, disciplinary action and complaints, and the role of Dental Council of India. General responsibilities of a dentist. Prioritize patient care. Dentists must place the patient's welfare above personal interest. Non-discrimination. Treat all patients equally, irrespective of the caste, creed, religion, gender, or socioeconomic status. Informed consent. Ensure patients understand the nature, risk, benefits, and alternatives of treatment before giving consent. Patient confidentiality. Maintain the confidentiality of all patient information unless required by law or with patient's consent. Professional conduct, competence and skill. Provide treatment with due care, competence and diligence as per established dental practices. Avoid conflict of interest. Dentists must not engage in practices where personal interests compromise the patient care. Honesty in representation. Refrain from misrepresenting qualifications, skills, or expertise in any form. Prohibition of unethical practices. Misleading advertising. Dentists cannot use exaggerated or false claims in advertisements. No commission or referral fees. It is unethical to accept or offer monetary incentives for patient referrals. Unnecessary procedures. Recommending or performing unnecessary treatment solely for financial gains is prohibited. Relationship with the patients. Respect and courtesy. Treat patients with respect, empathy, and courtesy at all times. No exploitation. Dentists must not exploit the patient relationship for any gains. Treatment of minors and vulnerable individuals. Consent must be obtained from parents or legal guardians for minors or individuals unable to make their own decisions. Record keeping and documentation. Accurate records. Maintain complete and accurate records of patient's history, diagnosis, and treatment. Retention period. Patient records must be preserved for a minimum of 3 years. Access to records. Patients or authorized representatives should have access to their records upon request. Continuing dental education. Lifelong learning. Dentists must stay updated with advancements in dentistry through participation in CDE programs. Mandatory compliance. Regular participation in recognized educational programs is required for continued professional development. Ethical research practices. Approval for research. Any clinical research must have prior approval from an institutional ethics committee. Informed consent. Participants must be fully informed about the risks, benefits, and objectives of the research. No exploitation in research. Ensure fair treatment and avoid any harm to research participants. Fee structure and transparency. Fair and reasonable fees. Charge the patients reasonably based on the treatments provided. Issuance of receipt. Provide receipt for all fees collected, ensuring transparency. No overcharging. Exploiting patients by charging excessively for services is unethical. Advertising guidelines. Permissible advertising. Dentists may advertise their names, qualifications, specialization, and contact information in a truthful and professional manner. Prohibited practices. Dentists are not allowed to use comparative claims, discounts, or promotions to attract. Prohibition of unrecognized titles. Use of titles. Only recognized qualifications approved by the Dental Council of India may be used on clinic signboards, prescription, and visiting cards. No misleading designations. Use of unrecognized or false titles is prohibited. Public health responsibilities. Community engagement. Dentists must actively participate in promoting oral health awareness through public health initiatives. Preventive dentistry. Encourage preventive care through education and outreach programs. Respect for colleagues. Professional harmony. Maintain a respectable relationship with colleagues and avoid public criticism or defamation. Referral protocol. When referring a patient, ensure clear communication and provide necessary treatment details. Prohibition of practices beyond competence. Scope of expertise. Dentists must perform procedures only within their scope of training and experience. Emergency care exception. In emergencies, dentists may provide necessary care but must refer the patient to a specialist as soon as possible. Disciplinary action and complaints. Handling complaints. Complaints of unethical conduct are addressed by the State Dental Council. Types of disciplinary action. Warning, suspension, or cancellation of licenses can be imposed based on the severity of misconduct. Role of the Dental Council of India. Regulation and monitoring. The DCI oversees the implementation of the Code of Ethics and ensures adherence to its guidelines. Revisions and updates. The Council periodically updates the code to address emerging challenges in the profession. This code emphasizes integrity, transparency, and professionalism, aiming to uphold the dignity of the dental profession while ensuring patient welfare. Don't forget to save it. Don't forget to share it. Take care.